Welcome to the Concierge Doc Podcast with your host, Dr. Jason Littleton.
Hi, welcome to the Concierge Doc Podcast. I'm your host, Dr. Jason Littleton, founder and CEO of Littleton Concierge Medicine. Welcome to the podcast. This is our inaugural podcast, and I want to talk to you about what is concierge medicine. And as you know, I'm a concierge doctor. I've been practicing for over 9 years. I've owned and founded Littleton Concierge Medicine back in 2015. And I started with one patient, and I've grown that to over 300 patients. And it's an amazing practice. It's an amazing way to practice. I have wonderful members, and it's just a wonderful opportunity. And I love what I do. A lot of people do not know what concierge medicine is. I think it's catching on now. I think more people are learning about it. More people are having conversations and talking about, I have a concierge doc. I have a guy I call upon. And I want to break that down a little bit. I want people, as it becomes more popular, to really know what concierge medicine is. Most people are used to insurance medicine, where they are one of probably 25 to 30 patients in a day. They are a chart or a number, not a person. Whereas in concierge medicine, people are people. People are like neighbors, and they're more than charts. They're not charts at all. They are people that you know. They're people that you laugh with. They're people that you have a coffee with. They're people that you get a chance to really celebrate their family with. Concierge medicine really is private and personal medicine to a whole nother level. I think it's like flying private, not even first class. You have your own jet, and you're on that jet with your doctor, and that's what it's about. Let's get into it. Concierge medicine is membership medicine, and it's where people pay, whether it's a monthly, quarterly, or biannually fee or an annual fee, to have access to your doctor. I know in my practice, Littleton Concierge Medicine, we have different tiers, and different tiers give you certain access to me. And this allows people to have a very intimate and accessible relationship with their healthcare provider. In this case, yours truly, Dr. Jason Littleton. Um, One of the benefits of being a member in a practice like mine, being in a concierge practice, is that you're able to get a hold of me or your doctor, even on weekends, even on holidays. And most people have to wait till Monday morning at 8 o'clock. And they may not even get the doctor they want to get. They may get the on-call doctor. So having membership in a practice like mine is being able to have someone who knows you, and someone who can make decisions with you. I often tell my patients that being a member of my practice is like going on a journey with me. We're side by side, and we're figuring it out together. And that's really what it is about. It's a journey that we do together, and the journey is your health. Concierge, we all have heard the term concierge from like a hotel concierge, where you go in. That concierge helps to book dining or theater plans for you. They help connect the dots in a situation because they have a certain angle. They have certain connections that you do not have, and they're able to do it in a timely and efficient manner that saves you time and makes things seamless and luxurious for you. Well, concierge doctor is the same thing. I connect dots with other doctors. I connect dots with other modalities that you might need, whether it's labs or imaging studies, or certain specialty referrals, in a very quick manner. In my practice, I like to say that I get that done in within 24 hours. You may want to see a cardiothoracic surgeon or a neurosurgeon, and you may call their front office and deal with the receptionist. You don't even have access to the specialty doctor that you're looking for, but you end up talking to their receptionist, and they may book you out 3 months, maybe 6 months. I've heard some people being booked out even a year. Whereas I'll speak doctor to doctor and get you in the very same week, within 24 hours. And in a lot of cases. And so that membership has privileges. I think There was a popular TV show uh, earlier in the millennium where there was an ER physician who played a concierge doctor to the rich and wealthy in New York. And I think that's where the term concierge medicine started really catching on. Um, and, you know, it is like that, but it's not just for the rich and wealthy. It's for the people who put a priority on their health. I mean, certainly I have in my practice multimillionaires, billionaires, even, and people who really make health a priority. But I have people who are not millionaires. What they do is they just prioritize their health. They've just chosen to say, look, this is so important. This is something that I value. I'm going to spend the money for the access. And that's what it's about. It's really a priority. It's really a priority. Your health is a priority. And so I have wonderful patients and I love taking care of them. I have, over 300 people in my practice, and that's about an average amount. Average practice has between, uh, a range of 80 to about 500 patients. And in contrast, the average insurance medicine doctor will have about 2,500 on their panel for that one doctor. So, I mean, that's just a lot. And that's why, per day, they'll see about 24, 30 patients a day. They'll see about a patient every 15 minutes, a new patient every 30 minutes. I mean, it's just ridiculous when you think about it. And I like to say that, in that type of practice, people are really charts because a lot of times the doctor does not know you until they look at the chart. Oh, this is Mr. So-and-so. Whereas in a practice like mine, especially in mine, people are like neighbors. I don't have to look at the chart to know what the history is. I don't have to look at the chart to remember what the last exam was or what the last, lung exam was. You remember that because you have a certain number of people in your practice. Not just that, you spend a lot of time with your members. I spend at least an hour with every member. So you can see concierge practice, concierge membership, medicine is a membership form of practice. It's exclusive form of practice where you have a limited number of people in your practice, but they are paying annual fee to be a part of that type and form of medical practice. It's exclusive and it's awesome. I think it's, the number one way to go. Now, concierge medicine is a broad term. In my practice, again, it's called Littleton Concierge Medicine, and I use that more of a marketing strategy. Yes, I am a concierge doctor, but concierge medicine, you could actually use insurance and for some things and pay a membership. Now, there's another subset of that, which is called direct primary care. And DPC medicine is where you pay a straight membership fee. You do not use insurance, even though people have insurance, like I said before, for tests, referrals, and things like that. But really, I have a DPC practice, a direct primary care practice, where people are paying an annual fee for access to me and my different tiers. I still call it Littleton Concierge Medicine because that is the term that people are familiar with. So, yes, my practice really is a direct primary care, but it's what people actually know as concierge medicine, and it is. But I don't accept insurance at all. So, Littleton Concierge Medicine, like I said, has been around for 9 years and very, very, very successful. I see people in their homes. I've mastered what I call the art of the home visit, where I get an opportunity to come in and sit down with people at their kitchen table or their office in their home, go over their history, examine them, really just like the old-fashioned doctors you'd see in the 50s and 60s on TV. And I've brought a uniqueness and a niche to what I do by really bringing that art form back. And, I've been amazed, and I think other doctors have been amazed how much of a need that is, especially during COVID. People didn't want to be seen in an office with other sick patients. They wanted to be seen in the comfort of their home. They wanted me to come to them. Um, and this has really just been remarkable. And so I've grown my practice off of home visits. And sometimes when you hear the word home visits, you think about geriatric patients or the elderly, but no, my patients range from, as a family medicine doctor, my patients range from the very young all the way to the geriatric population, everyone in between. I mean, I've got multimillionaires, entrepreneurs, CEOs, just busy people that love being seen in their home for the convenience sake, for the intimate sake. And it's just awesome. And I have cut my teeth on the art of the home visit. And really, I've really mastered that. And I really, show others and teach others how to be a home visit doctor because, really it is what people want. It really is what people want. They want that ability to be able to be seen at home in the comfort of their home where they're comfortable and where the environment really is their sanctuary. So that's a little bit about my practice, but that is a little bit about what concierge medicine is. And I'm going to go on and share more on the Concierge Doc podcast about what this is. You're going to learn more from me. We'll have interviews and I'll go over hot topics and things like that. But I want to, I just want to kick this thing off and, open up a little bit about what concierge medicine is for those who may not have known. And I wanted to share a little bit about what my practice has brought to the table over the last 9 years. So I'm pretty excited to come to you in this form. I'm excited for what's to come. I want you to follow me on my handles, Facebook, Instagram at The Real Dr. Jason Littleton. And I'm looking forward to the next podcast. Looking forward to talking to you really soon. All right.